before I share my screen. Yeah, because afterwards it's really tricky too.
I see.
Okay, are you seeing?
I can see the screen now.
Okay, and you see if it's recording?
I believe so.
Okay, perfect. Yes, I think it's recording. Beautiful. Thank you.
Great.
Okay, I'll
All
jump
right.
into the next one.
Perfect. Yeah, thank you so much. All right. So, thank you everyone for joining. As I mentioned, my name is Arleigh Dean, and I'm a senior project coordinator with the Princess Margaret Global Cancer Program. I graduated from Western with my Master's of Interdisciplinary Medical Sciences back in 2023. And I also did my undergrad at Western in medical sciences and completed that back in 2021. Next slide. Great. So, just starting off here with a bit of an introduction into what global oncology is. Looking around the world, 57% of the new cancer patients seen each year are in lower middle income countries. So, these are countries that are developing nations. They're still developing their healthcare systems. And the cancer cases in these countries account for about 65% of all of the cancer mortalities around the world. These numbers are based back from 2018, and unfortunately, they're actually only getting worse. And there's a projected wave coming as these populations start to live longer. So this is a very big problem for everyone in the world in healthcare and in cancer care. And as a world-leading cancer center, that's one that we here at Princess Margaret are trying to address. So next slide. So how do you go about addressing a challenge that's this massive? Well, you have to work together. And this is an African proverb here that my senior advisor on my team always refers back to. Go to the next slide. Great, thank you. Yeah, so Princess Margaret Cancer Center, we're a cancer center here in downtown Toronto. And we have a number of official partnerships with other international cancer organizations. You can see a map on screen here of most of them. So there's a mix of research institutes, some other cancer centers, which are other hospitals, and some non-governmental organizations as well. All of these groups have official agreements with us, like some sort of official document with their leaders stating that they want to work together with us to address common challenges in cancer control and more broadly to reduce the global cancer burden everywhere. And while this is a great goal, working together is very difficult. Everyone is very busy with their own problems locally. There's lots happening in the hospital all the time here. So there needs to be some sort of centralized support for all of these engagements around the map here. And that's where my program, the Global Cancer Program, comes in. We provide some central support from the hospital, some cohesion across all of these different engagements, and try to go about it with an overall strategy in mind. So rather than just everyone doing this on their own time, we have some sort of centralized official body, make it look very professional. Want to go to the next slide, please? Great. So, what do I actually do within the program? Well, as a senior project coordinator, I lead the management of the program. So, that's a lot of the communications, a lot of the business administration, keeping things organized, staying on top of budgets, running regular meetings, handling follow-ups, lots and lots of tracking progress, and just generally moving things forward. I also support the global health projects across the Cancer Center. So these might be educational seminars. Maybe there's expertise here at Princess Margaret we want to be sharing elsewhere, or expertise from elsewhere that we want to be sharing within Princess Margaret. Sometimes there's conferences, funding for research projects, and sharing knowledge with our network of global partners that you saw on the map earlier. And that's really probably the biggest part of my job is facilitating collaborations with our network of international partners. So linking faculty from around the globe, handling a lot of tours, some official delegation visits, and just in general promoting this idea of global oncology and international collaborations around the hospital. Next slide, please. So this is kind of a timeline view of my career thus far. I really got started with a co-op position back in 2019 at Sanofi, which is a vaccine manufacturing company in Toronto. I worked in bulk manufacturing there, mass producing vaccines against tetanus, pertussis, and diphtheria. It was a really cool experience. Working in pharma and making vaccines right before the pandemic really put that into the public eye, and suddenly everyone was interested in it. But still, it was a limited time engagement, and I had to come back to finish my undergrad in 2020. Before then, taking a job in the mass vaccination clinics at the local health unit in London. And that's where I really started to get a taste for health systems work, running some of the mobile vaccination clinics in remote parts of the community, trying to make healthcare more accessible to people that really, really needed it, addressing some of these disparities and gaps in equity. I knew this was something that I really wanted to explore further in my career. It was something that got me like really energized and very passionate about. And I thought I would need more education to do so and to get a career that I was, really interested in. So I decided to go back to Western again and do a master's degree in interdisciplinary medical sciences. And during that master's degree, it's a 1 year program, and I was in the cancer group. So I did experiential learning rotations in different labs and completing a capstone project on cancer. And my specific project was on lung cancer screening. And so cancer started to become a major area of interest for me. It's a very complicated field of cancer control. And I think, like probably many of you online, we all have some level of personal experience with cancer, whether it's ourselves or someone that we know, or, we're never too far removed from there. So it's an easy thing to be very passionate about. And so following that, I actually started to work part-time at LHSC for one of my rotation supervisors and continued on post-grad. Well, I made it clear I was looking for full-time work elsewhere. Want to go next slide, please? Right. So after my graduate program, or I guess more so during my graduate program, I really didn't know what I wanted to do next. Like probably many of you, the only careers I'd ever really heard about were doing research or doing clinical care, or there's this mysterious other of everything else. What does that mean, right? And through my experience within the IMS program, I sort of confirmed that I didn't want to pursue research as a career. I was probably in the minority that was never interested in medical school or clinical care. So that left me to explore these other pathways instead, this last one. Maria, if you want to click through here, I have some goofy animations. We can just get to the next slide. Thanks. Yeah, and so like most, I started scouring the job boards online. I was reading through job descriptions, looking for opportunities I was interested in. And I started looking into jobs in Toronto in healthcare, public health, some in pharma, some in biotech. And just by virtue of clicking through those fields in LinkedIn and Indeed and reading job descriptions, comparing what they were looking for versus what I had to offer and what I was interested in, I started to narrow things down. You can kind of see some of the search terms that I'd used over the years, some of the positions I was interested in. I really started to hone in on these project coordinator positions at UHN because I realized that they were actually looking for people with master's in science degrees. UHN is a very large hospital network. It's the network that Princess Margaret Cancer Centre is part of. It's also where Toronto General Hospital is part of. You've likely heard of it or come across it in some capacity if you're from the GTA. Um, but regardless, there's countless different teams. And so this project coordinator position was one that I saw come up a few times and felt like it aligned well with my experience level and a job description that I was actually interested in. So I started applying to these jobs. I was tailoring my resume and cover letter according to the skills that they were highlighting. And Maria, if you want to go to the next slide. But what really helped me the most was networking and putting a face to my name. You can see just screenshots of examples of cold messages I had sent people on LinkedIn. When I found a role or a company I was interested in, I'd message Western alumni in that role. I'd look for people I had mutual connections with, any sort of like way to have an in to get a conversation with them. And I would just try to book a short coffee chat, something, 15, 20 minutes. Ask them about their experience in the role, experience within the company, what they liked about it, what they didn't, how they got started, how they got their position there. I'd ask them for career advice or at times if there was a specific job I thought I was a good fit for, I'd actually find the hiring manager and message them directly to introduce myself and just express my interest in the role. And I would say most of the time when I did this, I was ghosted or stood up, or, you maybe do have a good conversation with someone, but then there's no follow up or there never ends up being a role available within their team. So it's a bit of a numbers game, but I just kind of kept putting myself out there and introducing myself and developing these connections. So next slide. And so I think if there's one thing to take away from my entire experience of getting my current role, it's this. Networking is how you get your foot in the door. I think we see a job application online and we work for a while tailoring your resume, tailoring your cover letter, and you convince yourself, oh, I'm absolutely capable of doing this job. They'll definitely pick me. Look how great my application is. Like, I'm definitely getting an interview. I'm going to get it. And you start to talk yourself into that, and then you never hear back. And the reality is, you were never wrong. You can do that job, you are qualified for it, but so can the 137 other people that also applied to it. So it's not that you couldn't and they thought you couldn't do the job. They just found somebody else that also could and hired them before they even got to you. You're essentially just throwing yourself into a lottery system and hoping you've got the right mix of keywords on your CV to get through and get your application actually in front of the person making the decision. I think when you're a new grad or when you're still in school, nobody really has too much experience anywhere. So you're competing for the same entry level positions with every other new grad that's out there. It's a very competitive market. And so having some sort of personal connection goes a really, really long way towards getting you in front of someone that actually makes the hiring decisions. And so this is ultimately how I got my current job. You can kind of see, I think this is a screenshot that I actually sent my current boss. But I still had to go through the full interview process, still start on contracts, still work my way up, prove myself, whatever. But networking is ultimately how I got my foot in the door in the first place. Next slide. So what is project management? Shifting gears now into a little bit about what my job actually is and what it entails. Now I'm pursuing a further career in project management. There's a definition on screen here of what that means. The planning and organizing of a company's resources to move a specific task, event, or duty towards completion. Basically a fancy way of saying getting things done. So you have a project, right, which is something new and outside of the normal operations of the hospital or the organization that you're working for. How do you shuttle it along that full project of initiating it, planning it, executing it, controlling and measuring it, and actually closing it out? That's project management in a nutshell, right? And there is this international standard called the Project Management Professional Certification that I'm currently working towards outside of work. This certificate plus work experience is what moves you up from my current level of being a project coordinator into the next level of being a project manager. And if this is a career that you're interested in, I would definitely encourage you to check out this Project Management Institute online. They also have an entry level certificate called, I believe it's a Certified Associate in Project Management. There is an exam fee. I wouldn't say it's overly difficult, but it might be useful for you just again in setting yourself apart to get your foot in the door. So next slide. So a career in project management, really the reason that I like it and that I've been so excited about it is that every day is different and every project is different. I've worked some jobs before where I was literally on an assembly line doing the exact same task repeatedly, and project management is far from that. There's some general processes and best practices, but rarely, if ever, are you doing the exact same thing twice. Um, it might be for you if you are really into problem solving. You're always reacting to challenges. Things always come up. You have to be able to adapt and improvise and keep things on schedule, keep them moving within budget and within your constraints. You get to work with people and oftentimes very interesting people. A huge part of this career is what's called stakeholder engagement, which is basically getting the perspectives of all the different people who are impacted by your project and shaping things according to their inputs. So you get to learn a lot from them and a lot about different teams. I've been, super, super fortunate in my role to learn from a lot of very brilliant people, hospital leaders from all around the world. And I think I'm never the smartest person in the room. I'm usually at the bottom of the totem pole, but it's great learning experience for sure. And lastly, organization. There's a million things going on around you within the hospital or within the business or within wherever you're doing project management. So there's lots to keep track of, and you have to make sure it keeps moving. And then last slide here. So whether you're interested in project management or not, or interested in a career like mine or not, I tried to put together some advice I have for you. Network early and often. I talked about it before, but that really is my biggest key. I would also encourage you, as you're wrapping up your degrees, to start reflecting on the skills that you're building, not just the facts that you're learning. So maybe that's analytical thinking skills, or being detail oriented, or great at working with data, or great at working in teams. But start to think of things in that way as opposed to expertise on a particular subject matter, because oftentimes these skills in medical sciences are very transferable to all sorts of other fields. I would also say don't get discouraged if you don't see results right away. Um, I definitely piled up my fair share of rejection emails, and you can't let those hit you personally. It will take time to find the right fit and opportunity for you, but you'll get there. And then lastly, get your foot in the door and work your way up from there. Really, the hardest part is just getting started and getting your first job somewhere. I started out on contract, scraping by in Toronto, and really had to prove myself over the first year to earn a full-time role and start to earn some seniority. But I think get yourself in the door, put in the work, be professional, be very eager to grow. You'll start to earn a good reputation with those around you and those above you, and you'll be rewarded for it eventually. And I believe that's my last slide there.
I think so. Yeah. It doesn't allow
Great.
me to go farther.
Thank you. Yeah, so with that, I guess we can open it up to questions.
Okay, just let me stop the recording.